like it. Well, we got a question. This one is from Skylar. It says, "Hello, DiMatteos. Last week, I called my doctor to get my Adderall prescription refilled. During the call, he asked, 'Do you take it every day or as needed?' When I told him daily, because I need it daily, my ADHD doesn't just vanish, he said, 'It sounds to me like you've become dependent on stimulants.' When I asked if we should try something else, he said, 'No, stimulants work best for ADHD symptoms.' And now I'm confused. I don't want to take any medication that I don't need. I really don't want to be addicted to something like Adderall, but if they're dangerous and my doctor thinks I'm becoming dependent, why wouldn't he want me to get off of them? Isn't dependence a really bad thing?" So this is obviously, this question kind of can go two different ways, the ADHD aspect, but I think the more interesting question is, let's talk about dependence.
Mm-hmm. Yeah. Yeah, there's a little nuance to dependence, and maybe the more correct word there could have been tolerance.
Okay.
Over time, whenever you take the drug.
Honestly, what about just like context?
Yes.
Right?
Yes.
It's like context and a proper means of communication. Like if you're going to throw words out there like that, you have to be ready to explain them. So
Yes.
whether you say tolerance, whether you say dependence, you're 100% right that it's
interesting. I was going to go there too. The tact with which this was spoken is very poor, and you know it is. I think that's and kind of where Dante's going too. That's part of the problem. I mean, it's almost like in a perfect world, you almost say, "Hey, doc, let's table this till next month. Maybe when you're having a little better day, or you didn't have three rough patients before me, maybe can we go over this?"
Yeah.
But essentially, when you take a medication like that has effect on neurotransmitters and on dopamine pathways. We'll talk about a little bit of that.
Yeah.
And has effect on other neurotransmitters such as epinephrine, norepinephrine. Your body, and you take it daily.
Yeah.
Your body does develop some tolerance to that over time. And why I'm drawing a little distinction between tolerance and dependence is tolerance is inevitable in the sense that over time, your body may not elicit the same response because you're giving it the same thing all the time. Your body tries to find homeostasis.
Right.
Basically tries to bring it back down to normal very slowly. Now the drug overrides that, but in it's lowering the amount of receptors that are available to norepinephrine and to produce that. It's lowering some of those, and there's more nuance to that. But
so in this case, with this, your brain is at whatever X is normal for it, and you're giving it extra. And so your brain is going to start over a long period of time, if you're taking it every day, start bringing down the amount it naturally produces to counterbalance what you are adding in.
Essentially. And what also can become a problem is because any drug like this that has some abuse potential, quite frankly, is working on dopamine. Dopamine is the reward center of the brain. It is the link to things that don't have to do with substances, to gambling, to adult films, to over-exercising, overeating, all of that has to do, let alone alcohol and drugs, has to do with dopamine. Dopamine links to all those things. We say, well, I'm taking an opiate, it's working on my opiate receptor. Of course, it's also working on your dopamine. And that's the battle. That's where, get too far here, but that's where therapy comes in. That's why, because to unwind that dopamine, it becomes very hard because that's how you were finding your get up and go, your reward, your satisfaction at times when you take it, that often. So just real quickly, dependence back to tolerance. So tolerance is kind of inevitable. Dependence doesn't necessarily become inevitable. That literally means that if you take the drug away, you're going to feel horrible.
Okay.
So they often go hand in hand. There's probably a point where one crosses over. There's a whole lot of tie-in, but dependences would be where I'm dependent on this drug. Not I need a little more dose. That's tolerance.
Okay.
A lot of nuance, but dependence, whereas if you took it away from me or you dropped my dose, I'm going to feel sick. I'm going to feel terrible. I can't function.
So in this case, if the stimulant was taken away, if the Adderall was taken away, he would go back to being very distractible, presumably, or hyperactive, or whatever it is that he's trying to treat with the Adderall.
In addition to potential withdrawal symptoms, depending on how long he took it.
Okay,
for example.
And that would be where the dependence is.
Yes, but even not to add another layer of nuance, you could even talk about dependence out of the lens of because essentially we're talking more bias to like addiction. Let's just say you could even say,
Yeah,
you could even say
word in there.
Yes,
Addiction. 'Cause it's not the same thing necessarily, right?
Right. Like addiction, dependence, tolerance. You can talk about them all under one bucket. Or if we just said dependence or physical dependence in and of itself in terms of a disease state, my cholesterol's high, I'm physically dependent on this statin to keep me at a lower risk of cardiovascular disease. Or this blood glucose lowering medication, I'm physically dependent.
Yes.
Because if my sugars aren't stable, I'm at a greater risk of all the diabetic complications. So I just think there's so many. I just think the clinician is responsible for all this stuff. If it goes the direction that Joey went, which is probably the most important direction of this conversation, that's important. But then you can distill it down to, hey, you could be physically dependent on your CoQ10 for your muscle.
Yeah,
for
I guess
your
that's
muscle
true.
soreness.
Okay.
Right. And I'm just being more kind of devil's advocate. But I think that's all very important. And that's up to us. Like even when we leave here and we have our conversations with people in the pharmacy, we got to watch what the heck we're saying.
Yeah, you're dependent on your Zoloft, even though it doesn't fire dopamine at all or get you high or do anything. You do become dependent on that because your chemicals have adjusted.
Right.
Yeah.
And then also, if we switch gears back to addiction momentarily, it's like forever they tried to split into two buckets, psychological and physiological dependence or addiction. When really, if we have any sort of respect for like the development of psychology and behavior psychology, those things are continually overlapping.
Okay.
But for a while, it was easy for us to say physical dependence, physiological dependence in separate categories. But then that implies that that implies like the whole willpower thing. And in this, it's a flaw in the person versus the brain so not to even go there, it's just so important to like
definitely
to just address all these kind of different parts.
Yeah.
Right?
And a huge part of this too, because I want to parse out the words. And so, he's taking it daily. That's, I'm sure, how it's prescribed. I mean, there's even something somewhere where you could say, as a clinician, well, maybe what if you try it on the weekends? My concern for you is that if it's every single day without a break, can you take a half a dose? Can you skip a dose on the weekends? What about Sunday? Do you kind of watch football all day Sunday, kind of hang out? Do you maybe skip it that day just to give your brain a little bit of a rest? And if that same person says no, and then the same person next month is saying, I think I need a higher dose, and they're taking two, they're sneaking a second one in before, then that's where you accelerate dependence. You then also accelerate addiction because you're pumping more into the dopamine cycle of this whole thing.
Yeah.
So you're saying, I take mine in the morning, I'm just getting by, I'm just functioning, or like I'm using it in these ways and using it as, a second one for a tough day.
Right.
I'm never skipping a weekend. I can't function without it. That's how then it can, continue to morph into then the tolerance dependence addiction phase. And I'm only going there because I think ultimately, I know the question isn't dependence a really bad thing? But I think my assumption is she's basically trying to say, am I addicted or am I going to get addicted?
My doctor made me feel like I was addicted.
Yes. So I may sound like I'm jumping ahead in some of what I'm saying, but that's what I'm reading into this question personally.
Right.
Sure. Yeah, for sure.
Okay. All right. So the idea that you are dependent is not necessarily the same as addicted, right? Because you can be dependent on, you said, a statin, or I know transplant patients have to take anti-rejection drugs their entire lives. So they are literally dependent on it, or it will kill them or reject the organ. So they're dependent, but it's not the same thing as addiction. In this case, because of the nature of the medication in question,
definitely,
there is a lot of overlap between dependence and addiction.
Your odds just go up from 0 to significant.
Got it.
And yeah, exactly. The point is, it just seems like it can only be beneficial to like destigmatize that conversation.
Right.
Yeah,
the doctor
you're not
not doing good work.
Statins are not stimulants.
Right.
but at the same time, this could be handled so much better, especially this day and age.
And remember that link,
yeah.
why, even though you're dependent, the link is the dopamine. And that's where I'll go back to again. It's something similar. You break your leg, you're on opiates for 2 weeks.
Right.
And you take it just as prescribed and you hate the way it makes you feel and you want to be done. There's no dopamine going off in your brain. You may be dependent on it after a month because your pain comes roaring back when you stop taking it. But compared to another person who gets that same prescription and says, boy, I like the way these make me feel. Boy, my pain's extra bad today. I'm going to take a second.
Yeah.
I'm out. I'm going to go to my doctor 3 days early. Then that person, to go back to the dopamine thing, they're taking the same amount of drug, maybe in a little less time, but they've activated their dopamine reward system. And then that becomes harder to unwind. And that's where you go into more of an addiction phase.
Yeah.
So I just think that's critical. That's, the kind of conversation that I would want to have in that situation, that, everything you're experiencing is normal. It's normal for you to need it, once a day. But let's just watch the dosing. Let's maybe try to take a day off here and there. Just understand that this drug is higher risk, but at the same time, if it's improving your quality of life versus the risk, as long as everything's on the table,
and
then it can be worth it for
part
you.
of it is maybe that's the biggest part of this is the conversation needed to be had, and it seemed like this doctor was not doing a good job of explaining what was going on and discussing the terms involved. This hits home to me. I'm an adult with ADHD, and I didn't start taking Adderall until a couple of years ago. And I do exactly what you were talking about. I don't take it on the weekends. If I'm not working, I'm not taking my Adderall. And, if I come Christmas time, I'll go a week and a half or 2 weeks without taking it. And absolutely, because I'm afraid of dependence. So it helps me to have this differentiation as well. I swear I didn't write this.
Yeah, and also helping the entire process.
That hit close to home.
And even and at the same time, it's like, even if you did take it on the weekends, it's so individualized,
right?
Because we you can't minimize the weekend tasks, right?
Right.
That's
Exactly.
where you have family stuff. So at the same time, if the ADHD is properly diagnosed and it's to the point where it's been negatively affecting your life, then your weekend tasks and weekend chores and weekend things with the kids and Christmas, all that stuff is equally important, and just further proves how nuanced and individualized that those conversations have to be with your doctor, because they could easily say, this could work for you, Tyler, to stop taking it on the weekends, and then
and
for John, it's not. For John Snow,
somebody could be listening and saying, well, I take mine every day. And so, these guys, they're telling me if I'm going to be dependent and addicted now because I take mine on the weekends. I think that's a huge point.
Tricky.
It's a critical point. Very individualized.
So the key is to talk to your providers, have a detailed conversation, and don't leave things unsaid. Ask the questions. If your doctor says something that makes you feel uncomfortable, like maybe you're an addict, you should ask some questions like, hang on a second. Does this mean I'm an addict?
Yep.
Okay.
Yeah, the differentiation of those words are key. And I think the last thing just to end on is take it as prescribed. Yeah. If you're doubling up on hard days and those kind of things, that's where you can begin to run into trouble.
And then even there was one other. Okay, so let's just say you get to the point where you're like, maybe I just don't. Maybe there's side effects. Maybe you get to the point where you're like, I don't like how this is starting to make me feel. I want to stop taking it. How do I change? Right?
Yeah. That is a good yes. Yeah.
What, I guess, kind of like what happens there? That's another individual.
If you are dependent on something,
yes,
correct usage of the term dependent. If I am dependent on something and I want to stop taking it, what do I do?
I think if we use some constraint, let's just say stimulants for ADHD, you get to the point
Very
where
situational.
you don't want it or you don't think you need it. The principle is basically low and slow. There's other medications that are non-stimulants that they don't work as quick, but they can be just as effective.
Okay.
That are used for ADHD. And then, I think
low and slow is the main point. Yeah.
The last one,
slow.
The last one, in addition to the non-stimulants, was cognitive behavioral therapy. Same thing. It doesn't work as quick, but it can be just as effective as the medications. So in the back of your mind, if you're ever to the point where you're looking for alternative options, that's probably a starting point for a lot of people, right?
That's a great point too.
That's what I did for years was CBT, and it helped me get along for years, and eventually, no, T therapy. No, I definitely did not use CBD to treat my ADHD.
Sorry.
That would be totally different. No, I did that for years. I built guardrails and had all kinds of systems in place, and eventually got to the point where I needed something else. But that makes sense. And having the professional that you're talking to, and not trying to go it alone, not just making these decisions out of the blue and then informing your doctor, oh, I haven't taken it for a month. That's probably a bad idea. Mm-hmm. Got it. Especially things like antidepressants and any of those things that are going to act, especially psychoactively, is that the right word? On your brain.
Yeah.
You don't want to just jump around on that stuff. Low and slow.
Low and slow.
Wean off slow. Definitely.
All right.